What?
Hold on, something's happening. We got cut off for some reason.
Okay, perfect. Okay, guys.
You might want to repeat that because we were cut out.
Hmm?
You might want to repeat what you just said because we were out.
Okay. We just cut out there for a minute, so if anyone missed anything, we're just going to go over all the question answers for the skincare final study package, and then we'll do questions and answers after. Okay? So number 1 is an accumulation of dead cells, sebum, and pus that form over an open wound or blemish while it is healing. That is a crust. A light, slightly raised mark on the surface of the skin formed after an injury or lesion has healed. That's a scar. A hypertrophic thick scar resulting from excessive growth of fibrous tissue. That's a keloid. A large blister containing watery fluid. That's a bulla. An inflamed, infected papule containing pus. That's a pustule. An abnormal cell mass that varies in size, shape, and color. Tumor. A skin sore or abrasion caused by scratching off acne lesions causing scarring. That's excoriation. Flaky skin cells like dandruff. Scale. A crack in the skin that penetrates the dermis like chapped lips. A fissure. A pimple is a small elevation of the skin that may develop pus. Papule. Swollen itchy bumps caused by insect bites or allergies. Wheal. A flat discolored patch on the skin is a macule. Small blisters containing clear fluid caused by poison ivy is a vesicle. A semi-solid lump containing water and fluid larger than a vesicle is a cyst. An open lesion on the skin accompanied by pus and loss of depth is an ulcer. And an abnormal rounded solid lump larger than a papule is a tubercle. Okay. Explain the difference between subjective and objective symptoms. Give 2 examples of each. Objective symptoms are felt by the client. Subjective symptoms are felt by the client, like itching, burning, heat, inflammation, pain. And objective symptoms are recognized or seen by the esthetician. So things you see on the skin are redness, inflammation, rashes, infections. Next one, fill in the blanks. What sudoriferous gland disorders are these? So these are all sudoriferous gland disorders, so you need to know that foul-smelling perspiration is bromhidrosis. Prickly heat with acute inflammation is miliaria. Perspiration deficiency is anhidrosis. Excessive perspiration is hyperhidrosis. Fill in the blanks. Dry, scaly skin from sebum deficiency due to aging, harsh soaps, or cold is astatosis. Caused by excess oil in the follicle that oxidizes is a comedone. We know that's a blackhead. Also called a boil filled with pus caused by bacteria from the hair follicle. So infection of one hair follicle is furuncle. So follicles, more than one follicle, is carbuncle. Whitish mass of sebum under the skin, not oxidized, is amelia. That's like a whitehead. Chronic congestion on cheeks and nose with redness, dilation of capillaries, and sometimes papules and pustules is rosacea. So that's the redness, chronic redness, and inflammation in a butterfly pattern across the cheeks and the nose. Severe oiliness of the skin is seborrhea. A sebaceous cyst or tumor filled with sebum that ranges in size, also called a wen, is a statoma. Next page. Types of acne. So acne is a chronic inflammatory disorder caused by lots of different things. So acne can be caused by cosmetics, stress, clogged pores due to different products that you might be allergic to, poor quality products, dirty makeup brushes, dirty pillowcases, poor diet, and it could be hormonal, genetic. Fill in the acne conditions below. So blisters on hairline and temple is acne variola-formis. Usually when you have acne or blisters on the hairline and temple, that's caused from hair products, shampoo, hairspray, things that come down off of the hairline onto the skin. Most common occurring at puberty, hormonally induced, acne vulgaris, cystic acne, acne conglobata, comedone acne from cosmetics. You can call it acnepecia or acne cosmetica. And pustules and cuperos in a butterfly pattern across the cheeks and nose is acne rosacea. Name the 5 most common treatments for acne and briefly describe each. So dermabrasion, like microdermabrasion, removes the top layers of the skin. Intralesional injections injects cortisone or steroids into the papules. Internal therapy would be Accutane, tetracycline, things that are ingested orally. Topical therapies, benzoyl peroxide, alcohol, things that you apply topically or directly to the acne spots. And cryotherapy is superficial freezing of the acne. Name the 5 most common treatments and name the different grades of acne. And the different grades, grade 1, 2, 3, and 4. So obviously grade 1 is least severe and grade 4 is more severe with redness and inflammation. So grade 1 is comedones and minor breakouts. Grade 2 is open and closed comedones with papules and pustules. Then we get into the papules and pustules and comedones with redness. And then the grade 4 is all of the above, papules, pustules, comedones, redness, and inflammation, and cysts. Okay, so it's cystic acne. Name this, so now we're going into skin disorders. Okay. An allergic reaction from contact with a substance or chemical is contact dermatitis. Redness caused by inflammation is erythema. Red patches covered with white silver scales caused by skin cells that replicate too quickly is psoriasis. Inflammation of the skin, including lesions, eczema, and papules, is dermatitis. An acne-like condition around the mouth consisting of small clusters of papules is perioral dermatitis. A chronic inflammatory skin disorder of unknown cause, itching and burning with oozing blisters, is eczema. Swelling caused by injury or infection is edema. And redness and itching prevalent in people that have nasal allergies, so people that blow their nose a lot or sneeze a lot due to allergies, is atopic dermatitis. The sun and the skin. UV rays weaken and eventually break down healthy collagen and elastin fibers. Explain the difference between UVA, UVB, and UVC rays. Which ones are the cancer-causing rays? We know the cancer-causing rays are the C, UVC. UVB is burning, and UVA is aging. UVA is the longest ray, and it penetrates the deepest into our dermis where our collagen and elastin is. That's why it's the aging ray. It breaks down all of our healthy fibers. UVB reaches, it's a little shorter, and it reaches into the epidermis, the fifth layer of the epidermis, the germinativium layer. So that's responsible for the production of melanocytes. And melanocytes go darker in the skin when they're stimulated by UV rays. So that's UVB. And UVC we know is supposed to bounce off the ozone layer, but because we have so many holes in the ozone layer, that UVC ray is getting through into the atmosphere onto us and causing cancer. Cancer-causing rays, UVC. Next page. Skin cancer. Name the 3 main types of skin cancer and give characteristics for each. So the least harmless is the basal cell carcinoma. This is non-life-threatening, and it looks like little light pearly nodules. Second serious, more serious, but not life-threatening, is squamous cell carcinoma, red scaly nodules. Squamous cell carcinoma does need to be treated. And then malignant melanoma is the worst. It is life-threatening. And this is dark scaly patches, jagged, rough, and black kind of looking plaques. Now, I know you guys also learned about the 4th level of skin cancer, which is kind of the more developed, untreated version, which is very common in people that have the advanced stages of AIDS, and very common in older men as well. And these are really dark purple black plaques. Name 1 main ingredient found in sunscreen that blocks out all 3 sun rays. Zinc oxide. So we talked about this last week. You always want to make sure that you have zinc oxide and titanium dioxide in your sunblocks because those are physical blocks, they're natural blocks. The more of that, the less chemicals. Well, harmful chemicals. Okay, bones. Going into some osteology. So what bones make up the thorax? So the thorax is the thoracic region. It's basically the same area that your thoracic vertebrae are. So you've got your thoracic vertebrae in the back. So vertebrae is one. You've got your ribs in that area in the front that come from the thoracic spine. So ribs, spine, and sternum. Okay, so that makes up the thorax. Give all the names for all of the ear bones. So we've got 3 different ear bones, main ear bones, and there's another name for each of them. You need to give the other name. So we've got stirrups. We know the other name for that is stapes. Anvils is incus, and hammers is malleus. Okay. On to hypertrophies. So overgrowth, thickening of skin. Callus caused by pressure or friction can be called a corn if grows inward. So that is keratoma. Pink or flesh-colored precancerous lesions that feel sharp and rough resulting from sun damage is actinic keratosis. Redness and bumpiness in the cheeks or upper arms from blocked follicles is keratosis pilaris. Changes in shape and color should be checked by a physician, mole. An abnormally thick buildup of cells is keratosis. And then your skin type and skin condition. Analysis and anatomy. So what determines the skin type you have? Genetics and ethnicity. You're born with your skin type. Two factors that determine the skin condition you have. So skin type you're born with, a skin condition is developed over time. So two factors that determine a skin condition is external factors and internal factors. Now, you guys remember that internal factors are called intrinsic factors and external is extrinsic factors. So things on the outside that can harm or age the skin, skin products, UV rays, pollution, sun, wind, outside elements, and things that affect you internally, like vitamins, sleep deprivation, diet, lack of water, those types of things. Okay? Name and explain the 5 layers of the epidermis in order. So the first 5 layers of the skin. You have the stratum corneum, so you don't have to go on and write 2 lines of descriptions. I want you to just write a brief description for each, okay? So stratum corneum is, you can just say horny layer, or you can say composed of keratinized dead skin cells. That's it. Stratum lucidum, translucent layer. That's the rubbery kind of layer that has no hair on the palms of your hands and soles of your feet. Stratum granulosum, cells that look like granules, and these granules we know are filled with keratin. Stratum spinosum, spiny layer. The spiny layer kind of has little hooks that hook into the layer above them. And then the stratum germinativum, this is the melanin layer. Okay? And this is where thousands and thousands of skin cells are reproduced every day. Now we are going into first, second, and third degree burning. First, second, and third degree freezing and burning have the exact same characteristics, so they're the same for both. Just know that for your exam. Okay, so first degree burning and freezing is redness and inflammation. Okay, then it moves into second degree, which is redness, swelling with blisters and potential scarring, minimal scarring. Then third degree freezing and burning is necrosis. And we know that necrosis means death of tissue. In this stage, the tissue actually starts to rot and gangrene can set in, and it can be life-threatening. So again, what does necrosis mean? It means death of tissue, and the tissue looks black at this point. Name 5 skin types and give 2 characteristics of each. So you guys learned this on the very first day of class. Remember, we had lots of board notes. That's the first thing you guys learned was skin types and conditions. So everybody should know this. We have normal, dry, oily, combination, and sensitive. And I don't want you to tell me what it looks like. I want you to give me a characteristic. So normal, you can say medium ostia, even texture, balanced secretions. Dry, flaky, superficial dehydration. Oily, shiny, thick. Comedones. Combination, just say a combination of oily and dry or a combination of dry and sensitive. That's fine because we're already talking about the characteristics for the other skin types, so that's fine if you do that. And then sensitive, blotchy, red, inflamed, Okay, 5 main skin conditions. So there's a lot more than just 5, so any 5 is fine. You can say acneic, pigmentation, rosacea, mature, dehydrated, asphyxic, actinic, atrophic. So just pick any 5. Okay, and again, just make sure if you're saying acneic, say pustules and papules. Pigmentation, you can say lighter spots or darker spots. Rosacea, you can say erythema, edema, pustules, papules. Mature, you can say wrinkles, pigmentation, lack of tone. And dehydrated is lack of water, so fine lines and crepey skin. Okay, so 2 characteristics for each. Now we're going to go on to the next one, and that is going into some of our physics information that you guys just did. So another name for sunburn is erythema solare. Hold on, I just want to make sure. There we go. Okay. What is the difference between a reactive skin and a sensitive skin? So a reactive skin reacts to a certain allergen. Reactive skin usually develops over time when you become sensitive or hypersensitive to certain chemicals or the environment or allergens in the air, pollutants. And sensitive skin you're born with. So that means you're sensitive to a lot of things. You can be sensitive to touch, to heat, to cold, to animal dander. You just overall have a sensitive skin. So reactive develops over time, sensitive skin you're born with. What is the difference between actinic skin and atrophic skin? Actinic skin is aging because of sun damage, and atrophic skin is lack of water and oil. So usually atrophic skin is common in a mature skin when all the secretions start slowing down, less water in the skin, less oil in the skin. So that's atrophic skin. What is the difference between dry and dehydrated skin? Dry is lack of oil, dehydrated, lack of water. What would a dehydrated acneic skin look like? It would look crepey with superficial lines, and it would have pustules, papules, and possibly comedones. What advice could be given to a client with distinct moles on their face or body? Just keep an eye on them, watch for any changes in asymmetry, border, color, diameter, and if anything changes, make sure and get it checked with your doctor the next time you see them. What is the difference between telangiectasia and cuperos? Cuperos is fine thread-like broken capillaries, and telangiectasia is just permanent cuperos. So it's a lot redder, it's definitely more apparent on the skin, maybe with some inflammation. Sometimes as an esthetician, you can actually treat cuperos with high frequency and certain modalities, but with telangiectasia, it takes a lot more to treat the broken capillaries, maybe more like a laser treatment or a fractional treatment that can actually resurface completely. Next one, what are 5 influences of cuperous skin? So what causes those broken capillaries on the skin? Pretty much any stimulant. So UV rays, heat, exercise, alcohol consumption, caffeine, drugs, spicy foods, using aggressive scrubs topically on the face can all influence cuperos. Even steam, hot steam in a facial can make your cuperos worse. A hot shower, a hot tub, all of that. Next, what is the difference between seborrhea sicca and seborrhea oleosa? So we know seborrhea is excessive oil, So remember, think of Seborrhea oleosa as disco ball oil. Those people that when you take a picture of them with a flash, it flashes off their nose, their forehead, their chin, their cheeks. There's just oil everywhere. And Seborrhea sicca, think of sick oil, is greasy, chalky, dirty oil, lots of comedones, pustules, papules. Like it looks greasy. And sometimes there's even an odor. What is found in the papillary layer and the reticular layer? So the papillary layer is the second layer in the skin. We have the epidermis and then the dermis. So we have the papillary layer and the reticular layer in the dermis. So in the papillary layer, we have glands, sweat glands, oil glands, blood vessels, and nerves. And in the reticular layer, the deeper layer, we have our precious collagen and elastin fibers. We also have hyaluronic acid and reticular fibers, which are also that mesh-like fiber that keeps the skin toned and firm. When dealing with skin analysis, briefly explain. So every time you give somebody a facial, you have to go through each section and write down exactly what you see on the skin. So texture means how smooth or rough the skin is. Secretion is either hypo or hypersecretions. Are they dry? Are they producing under the amount of oil and water they should be? Or are they overproducing? So hyperpigmentation. When you have hypopigmentation, or hyposecretions, the ostia are tiny, almost invisible, and when you have hypersecretions, the ostia is larger. Again, hypo and hyperpigmentation, hypo underproduction of melanin, hyper overproduction. So hypo lighter patches, hyper darker patches. Superficial or deep dehydration. Superficial dehydration, we know, is just that crepiness, the fine lines on the skin caused by lack of water. And deep dehydration is an actual wrinkle. So when you see wrinkles, the damage has been done in that dermal layer. And usually that's a combination of lack of water and oil. Circulation can be anything having to do with microcirculation. So redness and inflammation, blotchiness, hot spots, cuperose, telangiectasia, and rosacea. What are some reasons pigment appears on the skin, and what advice would you give a client? So we know that pigment usually appears on the skin because of sun damage. We would tell the client to wear a sunscreen every day. Even on cloudy days, they should wear a little bit of sunscreen. They should always put their face cream on, their serum, eye cream, face cream on first, and then their sunscreen on after. And people can use lightening products. So you can use a lightening cream, a lightening cleanser. These products have ingredients that actually impede and inhibit the stimulation of melanin. And I'm not saying that somebody that has a normal pigment skin can make their skin lighter. It's going to bring their pigment back to the way they were. So whatever their normal pigment is, it's going to bring their pigment back to that. It's not going to actually lighten what they were born with. Why is it important to do a verbal and physical skin analysis? Verbal, it's really important to verbalize what you want from the client and what you want the client to tell you. So you have to ask them proper questions. You have to ask them probing questions. And clients like to talk. So when you're asking them about themselves, they want to talk about their skin. They want to talk about their problems and their concerns. They want to talk about the products they bought 2 weeks ago that aren't working. And, so start that conversation with them and get them talking, and they'll tell you exactly what they need. And of course, you have to do your physical analysis because you need to give them your professional opinion. So you need to look under the microscope, under the mag lamp, and actually look at the condition of the skin and make suggestions based on that as well. Okay. Why is it important to give your client a skincare prescription, and how many products should you prescribe at once? You want to give your client a prescription, meaning you write out what products you're recommending for them and you leave it in their folder with their client consultation form. They may not want to buy the products right away, but if they come back to buy those products once they realize they've seen a change in their skin and maybe you're not working, if all that information is in their folder, then they can know exactly what to buy. If you don't write it down and they come back and you're not there or you're busy in a treatment, they're not going to remember. They never remember what exactly you used. So the receptionist will pull their chart up, they'll look, they'll see the prescription, and your name will be on it. So you'll automatically get the commission for selling the products, and the client will get exactly what they need. Now, if you don't have that prescription in their folder, they're going to come in and the front desk or the reception will look. If there's no information in there for them, they're going to recommend whatever they want or whatever they think they can sell. And it might not be the right products for the client, and they're going to get the commission. The receptionist is going to get the commission and not you. So very important to do that. If you are recommending product for your client face-to-face, you don't want to overwhelm them. So that's why we only recommend 3 products at a time. So the main 3 products that I find are the most useful for the client to start with are a proper cleanser or cleanser exfoliant, day cream, and toner. So those are the 3 most important, but you can recommend any 3. Why is massage so important during a facial? Massage does a lot during a facial. And you think about it, it's one thing that you do in a professional treatment that people normally don't do for themselves at home. So it pushes toxins and waste into the lymphatic system, so you can say it detoxes. It gets rid of puffiness. It firms and tones muscle fibers. It also relaxes elastin fibers. It puts clients in a state of relaxation. It stimulates sweat and oil glands. It increases circulation, so increases blood and oxygen exchange in the skin. So lots of benefits. You'll need to know 5. Male hormones are known as androgens. You can say testosterone as well. There's more male hormones. So generally you can say androgens. And this stimulates oil production in the skin. So yes, men are generally more oily because they have more testosterone, usually. Define pH and what is the skin's normal pH. pH is potential hydrogen and the skin's normal pH is 4.5 to 5.5. Is a dry skin more alkaline or acidic? It's usually more on the alkaline side. What is an acid mantle and why is it so important? The acid mantle is the layer on the skin that prevents dehydration, moisture loss, and prevents so you're constantly washing your hands or you're constantly using hand sanitizers, that strips your acid mantle and actually makes you more vulnerable to bacteria and fungus. So the acid mantle is made up of sweat and oil. That's it. It protects us against dehydration and bacteria. What is the purpose of the violet high-frequency electrode? So this is the mushroom or the spoon or the fulguration high frequency. The purpose is it's germicidal, or you can say kills bacteria. It's oxygenating. And you can also say that it Okay. No one can hear me.
Can I see the microscope? Just the pack.
This one? 2 minutes.
Say something?
Hi, everybody. We are back in business.
I don't know if
I hope we are. Give us a second here. Testing, testing. We're good. Okay. So, we just talked about the pH and the acid mantle, and we're talking about the purpose of the violet high frequency. So, it's germicidal, oxygenating, and heals papules and pustules. Describe the purpose of fulguration and when you would use it in a facial. So fulguration is the high frequency that sparks acne. So it heals acne and stops bleeding. You would use it after extractions, after exfoliation. So fulguration disinfects, stops bleeding, and is used after extractions. The purpose of desincrustation. Desincrustation is deep cleansing of the skin. So this is anaphoresis. What is saponification? Saponification is the liquefying of hard sebum in the ostium. Skin disorders, contagious diseases. Name 3 contagious diseases that you would not work on. So any 3. There's lots of different contagious diseases. You can say herpes simplex, verruca, and bacterial conjunctivitis. We know that bacterial conjunctivitis is pink eye. Name 3 hyperpigmentation disorders with brief description and 3 hypopigmentation disorders with causes. So hyperpigmentation, you can say melasma, chloasma, port wine stain, mole. We know that a melasma is a pregnancy mask, chloasma is liver spots, port wine stain is a vascular birthmark. And then with hypopigmentation, there are only 3, so that's easy. We have albinism, which is lack of pigment in the entire body. Vitiligo is caused by white spots on the skin. Sunlight makes it worse, or you can just say white spots caused by UV damage. And leukoderma is a congenital disease. So that means you're born with it, and the more you age throughout your years, you can get leukoderma really bad, or it can get better. They don't know why it gets better or why it gets worse, but it's a congenital disease, so your own pigment cells in your body are destroying each other. Okay. What is a contraindication? A contraindication is something that could cause harm to your client or that could make an existing condition worse. So you're not going to use electrotherapy on an epileptic client because it could induce a seizure. You're not going to use aromatherapy oils on a pregnant client because we know that those oils are very volatile. They go directly into the bloodstream and could cause harm on the fetus. So contraindications are things that could cause harm to your client during a service. What would you avoid in a facial on somebody that had Couperose. You would avoid heat or steam or hot towels. On a pregnant client, products containing essential oils or algae. We know that algae is also toxic to the fetus. On an epileptic client, you would avoid electrotherapy. On a diabetic client, you would avoid using a lancet or doing aggressive extractions. Somebody that has herpes or cold sore, you would avoid that area completely. And cancer patients, you would avoid electrotherapy. And if they actually had cancer, you would need a doctor's note. If they're in remission, then that's totally fine. Skin analysis. What type of cleanser would you use on a dry, flaky skin? So again, this is all the information you guys learned in the very first day of class. Dry, flaky skin requires a certain type or a certain consistency of product. So we know that that's a cream cleanser. What type of mask would you use on an oily skin with papules and pustules? Clay. 2 ingredients found in clay masks are kaolin clay and bentonite clay. What topics of conversation would you avoid with your clients? You never want to talk about yourself too much. You never want to talk about religion. And you never want to talk about politics, especially now. You could offend your client. Usually people are very opinionated. They stand in their beliefs and their religions and their viewpoints very strongly, and you don't want to offend anybody, because if you do, they're not coming back to you. And of course, avoid gossiping about other coworkers to your client. Your client doesn't want to hear you talking badly about anybody else, because they may think that you'll talk badly about them to other people too, and it's just an uncomfortable situation. Name 2 types of cleansers that would be suitable for an oily skin. Foam cleanser and an oil cleanser. So we know that you can actually pre-cleanse an oily skin with oil, and then you'd follow up and do a foam cleanse after. The pre-cleanse is oil, and the cleanser for every day would be the foam. Next question. What type of mask would be good for a sensitive skin? Name 1 ingredient found in this mask. A gel mask is best suited for a sensitive skin, and you can find ingredients like aloe vera or witch hazel or rose water. How would this information help you customize your facial for your client? So, exercise. Why would a therapist or an esthetician want to know if their client exercises? It's going to help you understand the skin and help you understand maybe why the skin is dull or dehydrated, or it's going to help you understand why the skin is so vibrant and healthy, because if you exercise a lot, you have lots of blood and oxygen flowing through the epidermis, which also helps with detoxification. Why do we want to know if our client drinks lots of water? Again, we are going to understand why the client is extremely dehydrated or hydrated. Sun protection, we're going to understand why our client may have hypo or hyperpigmentation issues. And bad habits, yes, we want to know if our client has bad habits. If they're heavy drinkers or smokers, or they take drugs, or they're going through even treatments for cancer, or if they have any debilitating diseases or degenerative muscle diseases. Anyone that's taking heavy medication is going to, it's going to have an effect on their skin. So yes, we need to know. We need to know why maybe our treatments aren't working properly. Why isn't the professional add-on mask that we did last month not working? There might be underlying issues to why that's happening. What types of questions would you ask a repeat client? So if your client is coming to you twice a month or once a month, you're not going to ask them the same questions over and over again. But some things do change, and there's some information that you do require. So ask them, have you noticed any differences since your last facial? Or have you noticed any changes in your skin? Do you need to refill any products? Do you need to buy any more creams? I noticed you were almost out of your eye cream. Do you want me to order that for you now before you completely run out? Do you want me to add on any extra serums or add-on masks? Remember the add-on masks I talked about last month? I want to try that on you. So always making suggestions with treatment and product that they haven't experienced yet. What types of questions would you ask a first-time client? So you know nothing about the client, they've come from another spa, maybe this is their first facial. You want to ask them right away, what are your main concerns? What are your concerns with your skin? What kind of home care do you use? Do you use creams, cleansers, exfoliation, and what brand? And of course, how much water do you drink? What types of exfoliation would you avoid on an oily skin with pustules and why? So someone that has an oily skin needs to avoid stimulation. The more stimulation, the more scrubbing topically on the surface is going to stimulate more oil production. So you want to be very gentle. You want to stick to enzymes and acids. Absolutely no scrubbing. Scrubbing causes inflammation, redness, and it can spread the bacteria to different parts of the face. Where is glycolic acid derived from? Is it an AHA or a BHA? Glycolic acid comes from raw sugarcane. It is an AHA. Name 5 AHAs and give their source. So we have tartaric acid, which comes from sour grapes. Mandelic acid, that comes from bitter almonds. Citric acid, that comes from lemons and oranges. Malic acid from apples, and lactic acid from milk. And all of these acids are very commonly used in professional skincare. Explain how an enzymatic exfoliation works. Name 2 enzymes. So enzymes work by eating topically off the surface layer. So they literally work like Pac-Man and they digest all the surface dead skin flakes. The 2 main enzymes used in skincare are papaya, known as papain, and pineapple, known as bromelain. Okay. What is a gommage and how does it work? Is it enzymatic or mechanical? Usually a gommage is mechanical. It can be enzymatic as well. It can be both. But usually it's kind of a thicker cream that you massage in just a little bit and then you kind of let it dry on the skin. And right when it starts to harden or dry, you just start rolling it off like an eraser. And it rolls off all the product and all the dead skin rolls off with it. Okay? What BHA, beta hydroxy acid, derived from willow bark, has an anti-inflammatory and antiseptic property? What type of skin would benefit the most from this product? So the most common BHA is salicylic acid, and oily, acneic skin would benefit from this the most, especially inflamed acne, when it's red, sensitive. Explain what a physical exfoliation is. A physical exfoliation is manual, mechanical. What type of skin would benefit the most from this? So who benefits from stimulation? A dry skin, a mature skin, a dull, asphyxic skin. Anyone that needs stimulation, oxygenation, blood circulation is going to benefit from physical exfoliation like a scrub. So dry skin. Name an ingredient found in certain retail products that could cause small lesions on the skin. So products containing ground nuts, like ground almonds, ground walnuts. Oh, okay. I think I'll just kind of do that. There's lots of retail products. Best for dry skins with lots of dead skin flakes. And you want to stay away from products that have nuts in them. Nuts are great for the body, nut scrubs, because they're really abrasive, but definitely not on the face. What happens is a lot of these products use the actual shell and they grind up the shell, but the shell has lots of little jagged edges, so that causes micro lesions on the skin, causing inflammation. So not good for the delicate skin on the face. What did Cleopatra bathe in to make her skin smooth and soft? She bathed in sour milk. How would having a hypothyroid affect the skin? So people can have hypothyroids, hyperthyroids. When you have a hypothyroid, your skin's drier, so lack of secretions. What is the first thing you should do before setting up for each service? So before you even start putting your products out and getting your bowls of water and setting up your hot towels, you want to wash your hands. Name 5 massage techniques that you can use in a facial, and what systems are affected by this massage. So we've got effleurage, petrissage, tapotement, friction, percussion, and systems are glandular, vascular, nervous, muscular, and lymphatic. You can also say secretory and excretory instead of glandular. Instead of vascular, you can say circulatory. How is a day cream different from a night cream? So normally a day cream will have SPF. You don't need to wear an SPF to bed, but you definitely need an SPF during the day. So during the day, usually the creams are a little lighter in texture and they have an SPF. Night creams are a little richer in texture and do not contain an SPF. Why would you recommend a serum for your client? So we know that serums are very special because they have tiny, tiny little molecules. The molecules are so tiny, they go directly through the epidermis, right into the dermis, and into the bloodstream. So they work on a cellular level, working from the inside out. So serums are basically a quick fix. If you want to correct an inconsistency in the skin or a problem with the skin, then use a serum. A serum should usually last for about 3 months, no more than 4 months. And once you've finished with that serum, your skin should have corrected itself. Why would you not apply toner to the skin before giving a skin analysis? We know that we want to give a skin analysis on freshly cleaned skin with no toner. We want to see the dehydration. We want to see how dry it is. We want to see how small or how large the ostia are. So we don't want to rehydrate the skin with a toner and get an unclear picture of our client's skin. Now, why would you suggest a toner for home care? Using a toner before you put your face cream on allows you to spread the cream evenly over the entire neck and face, and it also allows you to use less product. If you put a cream on a freshly cleaned face that's really dry and dehydrated, it's going to absorb that cream right away. And you're going to end up using more. And your skin can only absorb so much product. So if it's freshly hydrated with toner, it's not going to drink in as much, and everything spreads evenly and nice. So a toner is actually the #1 retail product that you should be selling with every client. Why are professional products more effective than over-the-counter products? We know that professional products contain a higher percentage of active ingredients. They have to claim that they have a certain percentage of active ingredients in order to be called professional. Over-the-counter products, retail products, can claim that they have hyaluronic acid, glycolic acid, vitamin E, and all of these amazing ingredients, and have the very most minute amount of product actually in the cream. So we like to say that professional products spend their money on development and research, and retail products like to spend their money on packaging and marketing. Okay, we're going to do some case studies now. So Kiki has seborrhea sicca and suffers from edema and erythema, so redness and swelling, when she uses her acne products she picked up from Shoppers Drug Mart. She says that the products she is using at home sting and make her skin feel tight. What advice would you give her? What retail products would you recommend? And how would you customize a professional treatment? So what advice would you give her? Stop using retail products on your face if they're causing inflammation and they make your skin sting. Now you can also tell your client they can use those products on their body. Maybe use it on the décolleté, use it on the arms so they're not wasting their money. What retail products would you recommend? Well, you're going to recommend a professional product for redness and inflammation, so probably the Sensitive Skin line. But she has acne, so maybe you're going to recommend a purifying mask so she can spot treat her acne with it, okay? But ultimately, you want to get rid of the redness and inflammation first and then treat the acne. And the next case study. Claire has a very mature, thick skin with mild rosacea on the cheeks and wants to resurface her skin with glycolic acid peels to reduce the appearance of wrinkles. What would you suggest? So you want to make sure she's got a thick, mature skin, so she probably has wrinkles, hyperpigmentation, but she also has rosacea. So suggest, again, something that's going to calm and soothe the rosacea, the flare-ups and redness on the cheeks and nose. So this is when you treat the skin as 2 skin types. You're going to use one product for a certain area and you're going to use a different product for another area of the face. And then she can use maybe on her forehead, if she's got wrinkles there, on her jaw, on her neck, where she doesn't have the inflammation and redness, you can sell her a glycolic acid or tell her to use the products that she already has in those certain areas, but avoid the sensitive areas. Next one, Natasha needs disencrustation to emulsify debris and oil in her pores. The process you would use is called anaphoresis, so creating anions, Natasha will hold the cathode, and you will hold Natasha will hold the anode, you will hold the cathode. You will use an alkaline product such as baking soda and water or saline solution. So again, when you're talking about disincrustation, we know it's anaphoresis. So remember the AAA, anaphoresis. Anions are being created on the skin, and the client is holding the anode. Now, Anita wants a facial for maximum product penetration because of her dry, crepey skin. You will use iontophoresis over an aqueous solution. So we know if it's an aqueous water-based solution on the skin, that's an acidic product, meaning there's positive ions on the face. So Anita will hold the anode, and you will hold Anita will hold the cathode, and you will hold the anode. This process is called cataphoresis, creating cations. And you will use, you can say, an acidic solution or an aqueous solution. Okay, and that's the same thing, CCC, cataphoresis, cations, the client holding the cathode. Okay, anatomy. Name the bones in the pelvic girdle. So the pelvic girdle is the pelvis area. So we've got the hips and the pubis bones. So the upper hip is the ilium, the lower hip is the ischium, the heavier posterior part of the hip, and then the front part is called the pubis. So ilium, ischium, pubis. Name the bones in the shoulder girdle. This is the shoulder girdle. We have the clavicle, the humerus, and then the scapula. Name all the sections of the vertebral column and give the number of each for each section. So we've got 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. How many intervertebral discs are in the spine? So the cushion cartilage in between each disc, there's 23. How many bones in the head? There's 29. How many bones in the face? 14. How many bones in the cranium? There's 8. How many ribs are there? There's 24 ribs. Name them including the number of each. So you've got 14 true, 6 false, and 4 floating. Or you can say 7 true, 3 false, and 2 floating if you're talking about the 12 pairs. Okay, name and explain the 2 sudoriferous glands and their differences. So sudoriferous glands are sweat glands. There's 2 different types. There's a sweat gland that's attached to an oil gland, and then there's a sweat gland that has a completely different fundus structure and is not attached to oil. So there's eccrine and apocrine. Eccrine is acidic. It's found all over the body, not attached to a hair follicle. It is stimulated during physical activity or stress. Released during physical activity or heat, and you're born with it. Apocrine is the opposite. Apocrine is attached to an oil gland or a hair follicle, so that makes it alkaline, which gives it a strong odor. It's found in the underarms, the genital area, the nipples, and it is stimulated during hormonal or stressful periods, and usually forms at puberty. Okay. 5 main sensory receptors found in the skin. So give the name and where each is found. So all of these receptors are found in the dermis. There's one receptor that's found in the subcutaneous layer. That's the deeper layer. That's the pressure. Okay? Everything else is found in the dermis. So Ruffini corpuscle is heat. Nociceptors are responsible for pain. Merkel's corpuscle is responsible for touch. Pacinian corpuscle is pressure. And cross bulbs is cold. Name the 6 functions of the skin and explain each in detail. So I think that's the last question. Six functions of the skin and explain each in detail. So sensation, senses, touch, heat, cold, pain, pressure. Absorption, the skin can selectively absorb product, and the skin also absorbs oxygen. Your skin breathes in oxygen, and it actually releases CO2 through the hair follicles. Secretion, sebaceous glands secrete oil, and this helps soften the skin and prevent dehydration. Excretion, the sudoriferous glands excrete toxins. Protection, melanin protects us from UV rays. Platelets protect us against, platelets give us the blood clotting ability. The skin itself protects us from microorganisms. And heat regulation. The body cools itself by sweating and blood vessel dilation, and the body stays warm by blood vessel constriction and the fatty layer in the subcutaneous layer. Okay, guys, that's it. That's all you need to know for your final exam. Anna will be sending you the final exam, not this week. Next week, I think we're doing resumes, and then the following week, you'll be doing your final exam. So make sure that you have your study guide complete and hand it into your folder, okay? Make sure you have all your answers, and then make sure that it's in there by the end of the week, maybe by next week, and we can go through and make sure that you guys have all the correct answers during our Zoom. Again, we're going to do Zoom same time tomorrow, and we can go over all of the answers that you guys didn't get today. So let's open it up to question and answers. And I'll try to answer your questions as best as I can. Good. Let's give you guys a few minutes. And just make sure too, you guys, Anna has put the systems test in your folder, so make sure you complete your systems test by next week. What about the systems chapter? The systems chapter is basically all of those chapters that we discussed last week. So you have to do your respiratory, circulatory, excretory. You have to do all of those questions, and you're going to find all of the answers in those questions. So I broke it down, and I'm pretty sure Anna has sent that to you guys. We discussed that last week, and she should have sent that to your folders. So check your folders. You do have the systems study sheet. So you have exactly the multiple choice questions that you need to study for your test. And I can send the answers and go over the answers with you guys tomorrow during our Zoom. Yes. You guys have to start working on your resumes. We're doing resumes, cover letters, interviewing skills, and written exam next week. Start studying, everyone. So yeah, you guys have to make sure you have your resumes and cover letters ready for me for next week. I want you to start working on them. I want a cover letter specifically for pick a spa, any spa. I want you to go onto their website. I want you to research what products they use, their location, their mission statement, and create a cover letter based on that information. And then I want you all to update your resumes. I don't want resumes for retail or fast food or bars or restaurants. I want you to customize your already amazing resumes to a spa job or a nail tech job, okay? And then you're gonna send them to me. We can go over them next week as a group and fine tune them. Interviewing skills, yeah, and it'll be really interactive next week. We'll do interviewing skills. So I will ask you questions and you'll have to answer them as a potential employee. And then you are going to be the employer and you're going to ask questions to your potential employee, because your future employer is always going to ask you if you have any questions for them as well, and you're going to always have to have an answer. Yeah, all the information is in your folders. That's great. Anna's done all that. Any other questions? I know there's probably still a lot of you that need to work on your study package. So hopefully we'll have more questions about that tomorrow during the Zoom. Yes. Oh, perfect. Okay, awesome. So Anna's going to send you some example resumes and cover letters, so you guys kind of have a gauge and guide on what's expected for next week. Yeah, Anna wants you to prepare your resumes and cover letter based on the class next week. So that's perfect. Well, just in case. Awesome. Great. So you guys have all that information, or you will. Huh? Okay. Yeah. One more minute here, guys. Again, if I don't answer your questions now, we're going to do it during the Zoom tomorrow. Again, make sure you subscribe and like, and make sure that you're always getting the notifications. Mina, answer of question 3. Question 3. Case study. The one with Kiki. Kiki has seborrhea sicca and suffers from edema and erythema. Is that the one, Mina? Or Natasha. Oh, Natasha. Okay. Okay, so Natasha needs desincrustation. So we know desincrustation is anapheresis. So the process is called anapheresis, creating anions. And Natasha will hold the anode. So that's the 3 A's: anapheresis, anions, anode. And you, as the esthetician, will hold the cathode. You will use an alkaline product such as baking soda and water or saline solution. Yeah, everyone's doing amazing. Everyone's doing really good at sending me their questions, their quizzes, their assignments. That's awesome. You guys are doing really good. Keep it up. You're welcome, Moji. Take care, guys. Okay, that's all for today. Have a wonderful day. It was great seeing you guys virtually. And we'll talk tomorrow during our Zoom, same time. Okay, Anna will send you the link. Bye.